Hello guys, Vanakkam and welcome to Meteor Academy, one of the leading academy for training nurses in nursing competitive exam as well as IELTS and OET. Today we are going to discuss few important repeatedly asked questions in OBG nursing. Let's begin the session. The first question is, following delivery, HCG disappear from the circulation within. The options are first month, 6th week, 4th week, 2nd week. This question asked in 2016 nursing entrance exam. Here the correct answer is option D, that is 2nd week. The rationale behind this is HCG can be detected in the maternal serum or urine as early as 8 to 10 days of fertilization. Maximum it will be there up to 8 to 10 weeks of pregnancy and disappear from the maternal circulation within 2nd week of delivery. That's why we selected the option D, 2 weeks. Next question is, to determine fetal position using Leopold maneuver. The first maneuver is to. Here, listen to the question very carefully. They are asking the fetal position using Leopold maneuver and they specifically asked about the first maneuver is. Here the options are determine degree of molding, determine the position of fetus, determine what part of fetus is in the fundus, locate the back, arm and legs. This question asked in nursing entrance exam 2018. And here the correct answer is option C, that is determine what part of fetus is in the fundus. In order to identify the exact answer, we should know the rationale behind what is Leopold maneuver. Let's see in detail. The fundal grip, otherwise called as first Leopold, used for fundal palpation to determine part of the fetus is present in the upper pole. Upper pole in the sense fundus. That's why we go to the answer C. And the additional informations are the lateral or umbilical grip. It is also called as second Leopold, which is used for lateral palpation to determine the position of the back, limbs and anterior fontanelles. And Pauli grip or second pelvic grip. It is also called as third Leopold. Here the examiner should face towards the mother's face and grasp the lower pole with the thumb and fingers to determine the part of the fetus at the inlet and its mobility. And the last one is the first pelvic grip, also called as fourth Leopold maneuver. Here the examiner should face toward the mother's feet to determine the pole of the uterus or presentation. A nurse caring for a high-risk pregnant lady with a heart disease, she must know which one of the following valvular lesion can cause death during labor. Underline the word death during labor. And the options given here are aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation. This question asked 3 times in nurses competitive exams. NCL Singrauli Staff Nurse Exam 2019, JIPMER Staff Nurse Exam 2013, ESI Staff Nurse Exam 2016. So here the correct answer is option A, that is aortic stenosis. The rationale behind this is the mortality due to aortic stenosis is highest during the perinatal period and the prognosis is very worst. So that's why we selected the option A, that is aortic stenosis. Suppose if they are asking the question like the commonest valvular disease in pregnancy, and the answer should be mitral stenosis. The commonest valvular disease, that is mitral stenosis, and the lesion which causes death, it is aortic stenosis. There is a difference, you see. The next question is, which type of blood transfusion is safest in severely anemic patients in later stages of pregnancy? The options given here are fresh blood transfusion by fast drip, fresh blood transfusion by slow drip, packed cell transfusion by slow drip, packed cell transfusion by fast drip. This question asked 2 times in nursing competitive exam 2013 and 2016. And the correct answer here is option C, that is packed cell transfusion by slow drip. The rationale is severely anemic patients in later stages of pregnancy should always be treated with Paxil volume by slow drip rates, that is 10 drop per minute. It is used to prevent the fluid overload which may cause cardiac failure. You might get the question like this also, like a pregnant woman diagnosis with severe anemia, her HB level is 7 gram per deciliter. She will be treated with, again the answer is going to be the same, packed cell transfusion. The next question is, at 8 weeks of gestation, the uterus looks like. Options given here are small unripe pear, large orange, size of grapefruit, and cricket ball. This question asked in AIMS Raipur Toughness Exam 2017. The correct answer here is option D, that is cricket ball. The rationale behind this is the uterus enlarged to the size of hen's egg or golf ball at 6th week, and cricket ball at 8th week, and a orange at 10th week, a grapefruit at 12th week, and a cantaloupe at 14th week, and a papaya in 2nd trimester. See, these things has to be memorized. If you by hardly know this, usually you can easily go to the answer, that is option D, cricket ball. The next question is, the fetal heart sound can be detected using Pinard stethoscope at between. The options given here are 16 to 18 weeks, 10 to 12 weeks, 22 to 24 weeks, 14 to 16 weeks. This question asked in SSBDD and DNH Nursing Officer Exam 2018. And the correct answer here is option C, 22 to 24 weeks. The rationale behind this is, fetoscope, otherwise Pinard stethoscope, is a type of stethoscope like a hollow horn. It is about 8 inches long and made up of metal, which is used to listen the fetal heart rate. You may also get some question like this. One can hear the fetal heart sound with the help of stethoscope at how many weeks of gestation? Actually, this question asked in AIMS Raipur Nursing Officer Exam 2019, and the correct answer here is 18 to 20 weeks of gestation. With the help of a normal stethoscope, the correct answer is 18 to 20 weeks of gestation. With the help of Pinard stethoscope, the correct answer is 22 to 24 weeks of gestation. The next question is, in which presentation the point of maximum intensity of the fetal heart sound at the level of umbilicus? Underline the word at the level of umbilicus. Options given here are vertex, breech, shoulder, and option both A and B. This question asked in RAC MSc Nursing Entrance 2013, and the correct option here is B, breech presentation. The rationale is, the point of maximum intensity of the fetal heart sound is around the umbilicus in complete breech and below the umbilicus in cephalic presentation. That's why we selected the option B. The next question is, the umbilical cord souffle is synchronized with. Options given here are maternal pulse, fetal pulse, none of these and all of these. This question asked in Nursing Competitive Exam 2013. And the correct answer here is option B, that is fetal pulse. The rationale behind this is, umbilical cord, otherwise phonic or fetal souffle, it is a sharp whistling sound produced by rushing of blood through the umbilical arteries, and this sound is synchronized with the fetal pulse. That's why we selected the option B. Additional information, uterine souffle. It is a soft blowing sound produced by rushing of blood through the dilated uterine vessels, and this sound is synchronized with the maternal pulse. The next question is, high level of alpha fetoprotein is diagnostic of. The option given here are cirrhosis of liver, Wilson's disease, hepatoma, obstructive jaundice. This question asked in 2016 ESI Toughness Exam, and here the correct answer is option C, hepatoma. The rationale behind this is, the maternal serum alpha fetoprotein is an oncofetoprotein produced by the yolk sac and fetal liver. Usually this alpha fetoprotein level will increase during neural tube defect. Example of neural tube defect is spina bifida. And also The level will increase in multiple pregnancies, isoimmunization of RH, intrauterine fetal death, renal anomalies, hepatic carcinoma in adult like maternal hepatoma. The alpha fetoprotein level will also get lower in trisomies, example Down syndrome and gestational trophoblastic disease. And the last question is, blighted ovum means? Option given here are ovum with embryo, ovum without embryo, ovum in lower part of the uterus, and ectopic pregnancy. This question asked in 2009 ESI Jaipur staff nurse exam. And the correct answer here is option B, that is ovum without embryo. Let's see the rationale. Blighted ovum, also called as anembryonic pregnancy, which means a fertilized ovum attached to the uterine wall but does not develop into an embryo. Due to high level of chromosomal abnormalities. So that is why we selected the option B, ovum without embryo. Thank you very much for watching this video, guys. Don't forget to subscribe, like, share the video so that it will be useful to others, and click on the bell icon. Thank you once again for listening this video. Don't hesitate to ask your questions. If you have any doubts anywhere, please drop your questions in the message box. Thank you.